how does like true reform look like? Because we've talked about vaccine as a religion, it's an ideology, it's like deeply rooted, but there's still a need for like this awakening that we spoke about. Is it just parents applying that pressure? Because we've got papers out there, it's published. Is more papers the answer, or is there some missing link here? Or can HHS or ACIP, can the governing bodies take action? Like, what can we do to accelerate this awakening that we spoke about?
I would say, number one, the first focus will have to be on informed consent and not forcing anybody to do anything. I think that's something that is manageable and within our reach. And I really hope that at least religious exemptions come back across the country, if not personal belief as well. I think that will at least decrease the temperature somewhat in the vaccine space, because nobody should be forced to do anything, and they should be able to make the decisions that are best for their family, and then we can move forward from there. And I do think we do need more research. We need a certain kind of research. We have studies that have been done, but it's not the studies that doctors are willing to agree are the best kind of studies or the studies that they want, but it is possible. We could do prospective studies. We could follow kids forward. We could do something like the Framingham study and follow kids for the next 10 or 20 years and look and see what we find. There are a lot of big databases that we have in America and other countries, and they could look at vaccinated versus unvaccinated kids, and those are going to be much more compelling. Like the Henry Ford study, if it had have been completed and peer-reviewed and put in a big journal, that would have been something that would have turned a lot of doctors' eyes. That would have been, like, something like that would actually change. I don't think we've quite had that yet, and there are a lot of retrospective studies, and it's our retrospective studies versus your retrospective studies, and their retrospective studies are bigger. You know, you have the big Denmark studies and other studies like that, which they can call to, but ultimately you're going to need studies, I think, similar to that, and that would really turn the tide. So there are many different ways to get there, but I think ultimately it's what's going on right now. It's continuing to have discussions, it's continuing to be open about it, and then ultimately I think that's going to be the final step to move things in a different direction, because that will be some incontrovertible evidence that doctors can't turn away from, because right now they can just continue to say, well, prove it to me. And that's what I get all the time when, you know, talking to the vaccine individuals, when you want to have a discussion or debate. They don't even want to discuss or debate it, because they say, well, you don't need to debate it, you don't need to discuss it, because that should be done in the scientific literature. And, you know, I try to say back to them, yeah, but it's the interpretation of the data that people are disagreeing, or which data you're picking and choosing from. And so I hope that now that this discussion is out there, more doctors will be willing to have those discussions. And we're certainly seeing it getting out in the open. We're certainly seeing major podcasts and shows, and with social media and people going on things that are not mainstream media, this conversation is happening, which it never happened before. So I think when you have that, you're going to have a lot of parents that are really interested to push for that research. You're going to have more and more people not getting vaccines, which is the last thing that a lot of doctors want right now.
I'd like to broaden the scope a little bit. I think that medical education needs to be fundamentally changed for pediatricians. So my current life's work is working with organizations like the Medical Academy of Pediatrics and Special Needs and the Independent Medical Alliance and the Institute of Functional Medicine to teach the underlying mechanisms that hurt kids and explain their process, no matter, you know, whether they've got asthma as their problem or autism. There are these very fundamental principles of promoting mitochondrial function and treating oxidative stress and doing anti-inflammatories, as Larry was saying, that we need to teach people. Pediatricians have classically been rewarded for doing a lot of short visits. So 5 visits in an hour is not unusual. And so you're in and out of the room just treating the ear infection or the cold, or, you know, giving the shots. We need to start rewarding people for actually counseling and talking to their patients and having in-depth analysis of how to help kids with chronic illness. I think that's going to be huge. And now that I've put in a lot of time actually taking care of patients, I really want to educate the world about that new paradigm. I'm putting it out to the universe so that you guys can support me in that.
We have a medical paradigm that treats symptoms. And what Liz is saying is we want to look at a medical paradigm that looks at root cause. And we don't do that in modern medical teaching, and I have seen young doctors craving that approach. Like, you know, and I remember a kid in my practice who was hospitalized for wheezing, And the mother looked at the doctor in the hospital and said, "Don't you want to help understand why my kid keeps wheezing?" And the doctor said, "Not really, it wouldn't change my treatment." And so that's really the essence of the paradigm that needs to shift, because the mother was trying to figure out, like, why does he keep wheezing? I mean, wheezing is like an anaphylactic reaction. What is he having an anaphylactic reaction to? So in answer to your question, I think there are top-down people and there are bottom-up people, and then there are people who are top-down and bottom-up. And so I think the answer is multi-pronged. There may be people who want to be in the system to work from the top down, to get agencies, to change regulatory agencies, to get health talked about in the health and human services, that you want to see governmental shifts. I don't know how possible that is because of how strongly corporations work and have their tentacles inside the inner workings of top. But I think, personally, I think it's always been a bottom-up, and that means that, and Toby said it earlier today, and I really want to re-emphasize it. Thank you, Toby. It's going to be the stories, and it's going to be the heartfelt, right? Because when people will say to me, "Well, Dr. Larry, vaccines are safe," and so, Patrick, bringing information that says they're not is like putting two North Poles of magnets together. They repel. Vaccines are safe. No, they're not. Vaccines are safe. Well, here are all the studies. That's two North Poles of magnets coming together. And my approach to this, which I think is a South Pole approach, is if somebody says to me vaccines are safe, my question is, "Oh, tell me more. How do you know that?" And then ask more questions. The Socratic method that invites people into the conversation rather than throws people out of the conversation. And you might get relationship first, which is really going to be, to me, the answer to your question, is we have so much animosity and so much adversity